Hi everybody, it's Michelle here again with Uhura. Here at Uhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content and you like what you hear on the channel, please be sure to subscribe. Today's topic is going to be my way of differentiating natural birth versus unmedicated birth. Because, and I want to talk about this because a lot of people will, myself included, at a certain point, will simply call a birth where you have your baby without an epidural a natural birth, but that's not necessarily the case. So here's what I am going to say is a natural birth. So a natural birth is a birth done with little to no intervention, also without medication, and for me personally, in an upright position. So unmedicated birth literally just means you bared your baby down, got your baby out without the epidural. So you can have a baby without epidural but still be hooked up to IVs. You can still have continuous monitoring. You can still have gotten induced. You could still have to get assisted with a vacuum. You could have gotten a number of interventions. There's a lot of interventions that I can't even think of right now because I've been up for 20 hours. But there's a number of interventions that could have, could happen in the birth process, but you still, birth your baby without an epidural. That is just an unmedicated birth. But it doesn't necessarily mean natural, because if you're hooked up to monitors and you have IVs and you have all of these different things going on, maybe you had to get antibiotics for something while in the hospital, all of these different things start to diminish the idea of a natural birth. So a natural birth, you can have a natural birth in the hospital. I've had a natural birth in the hospital. I have advocated for myself in a hospital setting when I was just 19 years old, and I didn't want the epidural. I didn't want continuous monitoring. I didn't want my baby to be monitored 24/7 with those big circular things on my stomach for the whole entire time I'm birthing. I didn't want that, and I told them it's uncomfortable, and I took it off, and I just said, I'm not gonna do this. We have to find a different way. I didn't want an IV. I said, can I just drink water? And I didn't know all the things that I know now. Just keep that in mind. I didn't know all of these things that I know now, but at 19, something in me just knew that these things are not normal. Like, this is not something that I want to do. I don't feel comfortable. Why am I strapped in this bed with cords all over the place? I don't want this. Like, this is not, I don't want that. I don't want that. It's no need. Am I dehydrated? I could just drink water. Why do I need an IV? No, I don't want the epidural. And I just advocated for myself. And that's one thing that I love and appreciate about my mother, because she gave me that gift to and most of the people who know me, like, personally, know that I am going to speak up and speak out for myself, no matter what. And so I don't back down from challenges, and I'm very bold um, in my tone when I need to be, and I just really will not reconcile with something that I don't believe in. So um, to get back to the point, I was like, no, I don't want this, I don't want that, I don't want this, I don't want that. I really just want to. I didn't even know why I wanted to be at the hospital, because honestly, at 19, it's like everybody was just like, oh, it's time to have a baby, let's go to the hospital. I felt like I could have just sat there and just, you know, waited until it was time to actually, bear the baby down. So for me personally, I really just, um, I didn't need any of that stuff. And so I pretty much had a natural birth in a hospital. So it can be done. It's very difficult to do, because of all of the push and pull. All of these people are going to be saying, you need to do this, you need to do that, you need to do this, and we need to get you on here, we need to get you started with this. And there's so many different routines that's associated with birth, which I really don't understand, because when you go into the hospital for something as normal and as natural as childbirth, you shouldn't be treated like you have a sickness. And I think often we are treated like that. We are treated like something is wrong, and we need to start these things, and we just have this medicine on the side just in case. And all of these things put fear in us. All of these things give us this sense of it's just uncomfortable. And so for me personally, I just want to, differentiate the two and let you know that unmedicated is amazing. Um, but there's a difference between natural and unmedicated. So a natural birth versus an unmedicated birth is simply just the amount of interventions, the amount of, you know, medications received, because they may want to give you, um who knows, there's so many different things, like, oh, well, we found this in your urine, so let's give you a steroid, or let's give you an antibiotic just in case there's some type of infection, or just in case you're gonna need a boost for something. And it's like, why? It's these just in case situations are not absolute. And for me, that starts to take away from the process of just naturally having your baby. So those are the differences between the two. um I was asked this question because I was in a conversation with a few people, and like I said, it was just pointed out to me like, oh, I had a natural birth, and the conversation came up and we were talking about it, and it was like, well, that's not necessarily a natural birth, but more so that it was a unmedicated birth. So I just wanted to point out those differences, especially because uh the new generation and our young women may think that all of those interventions are normal and that they are natural, but they are not. And you don't need them unless you do. So that's more so my take on it. And I'll do other videos to talk about when you would need an IV, or when you would need continuous monitoring for your baby, when you would need any sort of real medical intervention in the childbirth process. And that's just basically if you have pre-existing conditions, if you are someone who is struggling in your pregnancy process, or if you're dealing with a current condition due to the pregnancy. So all of those things, if you're high risk, there's a lot of, if the baby has been in some type of distress, there's so many different things that you could possibly need these things for. But there's also other ways, to figure those things out without having to have, continuous, medical intervention go on and on and on. Like, again, I said this in a different video. A lot of times these routines are just done as soon as you come into the hospital, so that they don't have to continue to pop in on you. So if they can sit at the desk and see, oh, her blood pressure is this. Oh, the baby is, the baby's contractions are that. Oh, this is here. We don't have to go and be bothered with this particular patient right now. Quote, remember, I don't like that word, but that's why I wanted to, quote. Um, so we could just, wait and see until she gets a little closer or whatever the case may be. But it's uncomfortable. You're literally uncomfortable. You're in this bed wrapped up and like a mummy, and you have cords and you have a pole and you have all of these things. It's like you're bedridden. You feel like a sick person when you're not. So that's why for me it's just like, no. But yes, this is how we have to see unmedicated versus natural, because there is a difference. So if you are shooting for a natural birth, if you're shooting for something more along the lines of natural and comfortable and peaceful, then you need to know that all of those other things that come with intervention is not going to be the way you want to go. Of course, I want you to be healthy as possible. I want the baby to be in tip top condition. So you definitely have to keep that in mind when you're thinking about having a natural birth, whether it be in a birth center, home, or a hospital. But that's something that you need to take into consideration as well. But again, that was just my take on separating the two. And if you guys have a topic that you would like me to talk about, please reach out to us at birthuhura@gmail.com. If you would like to discuss this further, please drop a comment, ask questions. I'm always, checking and seeing if anyone needs any additional resources. And yeah, so I will see you guys for the next video. Again, my name is Michelle. I'm a full spectrum holistic doula with Birth Uhura. Peace and pregnancy deaths.